Hey, this is video 3 of our functional medicine series doing case study Jemma. If you're just now joining us, you definitely want to watch the first and second video because you'll have a little bit more background on what's going on with Jemma. So, we last talked about calcium levels, and she had on occasion some slightly elevated calcium levels, and we were concerned about that. Also, one thing I didn't mention, that elevated calcium levels can sometimes be from certain cancers. So with a history of cancer, we really want to make sure that we watch any increases in upticks on this. You know, it's interesting. There was chronically elevated calcium levels in patients, so over 10 something in an adult, are more harmful than short periods of time where they're really high. So, and it can sneak up on doctors of all types. If you've been seeing a patient, they just, they've got bone loss issues, osteoporosis, and you routinely see their calcium levels at 10, 10.1, 10.2, you really need to consider running a PTH. You don't want to miss that. So, all right, moving on here. Everything looks pretty good there. Alkaline phosphatase. All right, ALK-Phos. This is an enzyme. So you see the reference range 33 to 115. Healthy is around 70, 75. Above that, 70, 75 is where you want to see it. She is low, and if you look at her, trend, she, well, at least in 2016, 2017, it was probably okay. 2018, she started taking a shot to improve her bone density. I'm wondering if that was related to the dip. And again, it's down again. I have to check. She's on a Prolia injection for bone loss. Normally, it seems like it does run a little bit higher, but let's talk for a minute about ALK-Phos. ALK-Phos is an enzyme, and this enzyme is found in bone, liver, GI tract, skin, and the placenta. So any disruption of tissue in that, for example, if we had somebody with breast cancer, we started seeing a really elevated ALK-Phos, we start to concern ourselves, well, did that cancer spread to the bone? Once we see a high ALK-Phos, and we're not 100% sure where it's coming from, we run what are called isoenzymes, and that will kind of direct us. Okay, is this a bone enzyme? Is this a liver, GI tract, or where's this ALK-Phos coming from? Okay, let's see. Also, too, ALK-Phos heavily relies upon the mineral zinc in order to be formed. So you can also see it in somebody who has an underfunctioning thyroid and low progesterone levels. So both of which are her, but those are being managed well. And so when I'll see a patient who has low ALK-Phos levels, in medicine, low ALK-Phos levels aren't considered until they're under 33, and most doctors just ignore it. But you should really get on zinc, and it's going to be very helpful for you. Okay, so a little bit more information. It's formed in the liver. If there's some obstruction in the liver, either from cirrhosis or a tumor or something like that, or a clogged duct, you'll see an elevation of it. Most common cause of elevation is liver issues. It's large amounts are needed for bone formation. So if we see rapidly developing bone cancer, you'll see high levels. We talked about healthy is 70 to 100. When it's low, you need to start thinking, is the person deficient in zinc? Zinc deficiencies, mild zinc deficiencies are common, and she doesn't have a frank deficiency because that can lead to a lot of other issues. But she could probably use some in her diet. Signs and symptoms of a zinc deficiency are loss of appetite, slow growth if you are a developing youngster, and sexual immaturity, skin changes, diarrhea, loss of appetite, hair loss, and immunological functions. So when there's low zinc, that's why zinc is one of the treatments for viral issues. So get your zinc levels up, and it helps your immune system stave off certain pathogens. So Very high in oysters. There you have it. Eat your oysters. Okay, signs and symptoms of zinc deficiency. We talked about that. You can get white spots on your nails. Sometimes there's a reduced sense of smell, acne. Teenagers will often take zinc when they have acne. You'll see men with swollen prostates. Increased susceptibility to virus, and cuts are healing slow. So she could definitely use more zinc in the diet. All right. Next couple, AST, ALT, those are quote-unquote liver enzymes, and those are looking spot on good. They're really around 20 is where you want to see them. This was her parathyroid hormone, which was good. It was 52. Remember we talked about there was one point where she had higher than a 10, and her oncologist ran a parathyroid just to see if she had any tumors, because she also did have the parathyroid are 4 little small glands that are stuck to the thyroid gland. So that is a normal looking parathyroid. It's interesting. Sometimes labs will give you interpretation guides. So, for example, on her, let's say her calcium levels were high, but if she had normal or normal high parathyroid levels, we need to look at hyperparathyroidism. So, all right, vitamin D. Her vitamin D levels are pretty good. It's between 30 and 100. She takes about 10,000 a day to stay that way, and she's been pretty consistent doing that. So vitamin D is important for healthy and strong bones, but even more importantly, it's called a D series resolvin, and it is very helpful for the immune system, especially for the resolution of inflammatory events. So when there's an inflammatory event, either an infection or autoimmunity or just tissue damage, we call those DAMPs and PAMPs. Vitamin D, as well as certain omegas, are omega-3s, EPA and DHA, help resolution chemistry take place and for there to be brought back to an anti-inflammatory state. So in any autoimmune disease, you create a debris field, and that can interest the body more in autoimmune disease. So you really want to get your vitamin D levels up. She even has a little bit more room to go if she wants to. It can be very helpful for controlling the epitope spreading, we call it, of the autoimmune disease, and can quiet things down a little bit. All right. That's the end of her lab work. Okay, we are at the 8-minute mark. Let's take a quick glimpse of her current lab work. If you remember, the reason why she's coming in again is because she's been doing great for the few years after her last recurrence, and everything was very steady. She got back from a trip to Central America, and she had abdominal pain. So, you know what? I'm going to stop it here. This will be a good place to stop, and we'll do another video. And I think this will be part 4, and we'll review her new labs, and we'll kind of we'll compare them to her older labs and see what's changed, and maybe we can tie a few things together in our functional medicine approach. So